I am heading to pre-op with my primary care physician for the exchange surgery that is happening in 2 weeks. This time around, I'm getting to do the pre-op, all the pre-op stuff, not in a rush, the way that it's supposed to be done 2 weeks out. And I don't know what we're doing today. It's weird to me that I have to do this again, since I've just did this like 5 months ago for the original mastectomy. But they said, yeah, for every, surgery, anytime that they're putting you under anesthesia, you got to do it. So I'm going to go do it. There may be a blood test or blood work and maybe an x-ray because of the area that it's at. I don't know. So I'll let you know. I am meeting, like I said, with my primary care physician. I have not seen her for about 1.5 years. The last time that I saw her was the second time I had gone in complaining about pain in my left breast. Now, I don't blame her for not catching it, for not seeing it, but thank goodness I was going in for pain and, getting this idea in my head that, hey, I need to see a genetic specialist. It turned out not to be connected to the breast cancer. A lot of breast cancers don't hurt. You don't feel them. But this pain ultimately led me to the genetic specialist's office. But there is a little bit of weirdness, and I don't know if she's going to feel that too, or she's going to think that there's weirdness. So we'll see. We'll see how Dr. Dick is doing this morning. Okay, so I'm all done with Dr. Dick. It was really easy, just a couple of questions, a quick exam, and I did my lab work there in the office, so it was all pretty straightforward. So that is it for me for 2 weeks, and I will check back in on surgery day. It's the morning of surgery too, and I have to check in at the hospital in 2 hours. I'm just getting up and around right now, so I will check in with you again after I've gotten there and done all the paperwork and getting ready for surgery. Hi everyone, so we're just about ready to go into the OR. This is my second surgery. This is the exchange surgery where they will be swapping out the expanders for my permanent implants, and they're also going to be reshaping some of the breasts. I'm not nervous this time, which is awesome. Such a big difference from the first surgery. I was so scared and crying, but I feel good about this one. I've already talked to the surgeon and the anesthesiologist, and I'm all taped up and wired up and just waiting to go in. So I'll see y'all in a couple of hours.
Okay. Joy, 12 for us. 12 for us, though. Okay. Yes, correct. Okay. We'll take good care of her for you, okay?
Yeah. Snuck it in.
All right. See you in a couple of hours.
Enjoy that cocktail.
Very good. My post-surgery interview.
Okay.
Okay, so I'm out of surgery and I'm feeling a lot better than I did the first time. The first time that I had had gone into surgery. It was a 7-hour-long thing, and when I came out, I was completely out of it. Felt like an elephant was on my chest. And this time, there's a little bit of pain, but like it's so manageable. And like as soon as I came to, I was aware of what was going on, so that was nice. I feel back in control. I've got some medication coming up from the pharmacy, and when that happens, I think I'll be rolling out of here. So I'm home, of course. It is the same day. It's 6 o'clock. My surgery was over, and recuperation was over 3 hours ago, so I've been home for about 3 hours, and I'm the pain is not bad at all. Nothing compared to what I went through before. Like, this is, I mean, I feel it, but it's not, this is okay. I'm really tired. I'm exhausted more than anything. So I am going to lay down and go to sleep and see how it's going tomorrow. Okay, I'll talk to y'all then. Bye. Okay, so it is the next day after my surgery. I am with it. I feel good. The pain is fine. It's still fine. It wasn't just like an after surgery anesthesia haze. This is really going to be manageable, and I'm going to be really happy to get back to normal life shortly. There is one final piece to this whole breast reconstruction puzzle, and that is the final nipple reconstruction. If you've watched my previous videos, you know that I have one nipple, so the other one does need to be reconstructed. What they do is they go in and gather up the skin that was overinflated when I was having my expansion, so they take that excess skin and form it into a nipple, and then I get it tattooed, and the color to match and the look to match and everything. So that will be happening, but not for a while. As I understand it, it really can't happen prior to 2 months, so it'll be a while. Also, some good news. I have rescheduled a couple of appointments that I had canceled previously. I was going through some things at the time, and I just wasn't prepared mentally or emotionally to do those things. One was the follow-up with my oncologist. I just wasn't ready. I am now. I'm going to be seeing her on Monday, so in a couple of days, and talk to her and see how things are going with me. And the other one, which was the big one for me, was the Transvaginal Ultrasound. I am going to do it. I've confirmed with the hospital and the billing and my insurance that all of those pieces are covered. There's just so many pieces when you get down and dirty with the insurance and the hospital and the going back and forth. There's so many pieces. It can be so frustrating, and you just got to stick with it. Be tenacious and do your homework and your research. Get numbers, get tax ID numbers for everything. I'm clearing my throat a lot. I didn't have this the first time around. I've got a sore throat after the surgery because of the tube. Didn't have that the first time, but I'm definitely feeling it this time. So got a little bit of a sore throat, so I'll be taking care of that today and tomorrow. All in all, I feel really good. I feel really good, dudes. Like, they told me to just take it easy for the first 48 hours. Really just bed rest, couch, sitting, not doing much. I can walk. They do recommend walking. Of course, it's good for you, just to, get out and get some fresh air or something. But no lifting or regular activities until at least after the first 48 hours. So I am on my butt for the rest of today and tomorrow, and that's fine. I can use the rest. And then I did take the week off from work, and I do need it because I can't lift anything. I really can't exert myself that much for that first week, so I will take the opportunity to really rest and get my breath back. Bye.